How heavy should my period be?
So as far as bleeding goes, we consider heavy bleeding. So, if it's light bleeding and you're able to change a pad or tampon, a couple times throughout the day, that's great for some patients. We get most concerned when bleeding swings the other way with the spectrum and you start to see heavy bleeding. That can actually drop your blood count. You can become anemic from that. So we start to get concerned when we have patients that see us that say they're changing either a pad or a tampon or a menstrual cup hourly or more. And that's the type of bleeding that usually requires a little bit more investigation and workup to make sure there's not an underlying thyroid issue or we're not actually getting anemic and dropping our blood count. So we start to get a little bit more concern on the heavy side of things. Outside of that, there's just normal variation. I have some patients that have, a 3-day period that's really light and that's how it goes for most of their life. That's great. I have other patients who have irregular periods and some are heavy and some are light. So there's some variation of what's considered normal. The main thing I would stress would be, if you're the person that's having that really heavy bleeding, have to bring change of clothes to school, changing pads or tampons hourly, we really should look into that to make sure that's not an issue that continues on for a long period of time.
I was going to say that word normal, maybe we should do air quotes around.
Right, exactly.
Is it really more, it's what's normal for you?
I would say just body awareness, yeah. So, there's a reason sometimes that you may not have a regular period, and that just may be, how it has been for you. Sometimes there's conditions that can lead into that. We have a lot of patients and women that have PCOS, which is polycystic ovarian syndrome. That makes it more normal to have an irregular period or goes along with that condition. So most women's uterus didn't read the textbook and have a period every 28 days. So there's definitely some variation there. And so knowing what's normal and typical for you. So if you have a different experience, whether that's a heavy period out of the blue or spacing that's getting really different for you, that we're checking in and looking closer with that.
So looking for changes specifically to your personal norm, perhaps.
Right, exactly. Yeah, I think that's an important point, that you brought up, that not, all of your friends, your relatives, your mom, your sisters are going to have the same, periods and cycles and symptoms. So it's really, what are you used to experiencing? Is it okay with you? Does it make you, uncomfortable or affect your life? And then having that open line of communication to discuss those things with someone.
Excellent.